Starting January 1st, 2026, if you're on traditional Medicare in Arizona, Texas, New Jersey, Ohio, Oklahoma, or Washington, artificial intelligence will be helping decide whether certain medical services get approved or denied. This is more than just prior authorization. This is AI-powered prior authorization. And if you're in one of these states, you need to understand what's really happening here. So I covered the basics of the WISeR model in my last video, what it is, which services are affected, and which states are in the pilot program. But what I didn't dive into is the bigger picture, how AI is already being used to deny Medicare claims, why that's a huge red flag for this program, and what it means for you if you're trying to get care. So let me break down what's really going on, because here's what most people don't realize. AI has already been making coverage decisions in Medicare Advantage plans for years now, and the results have been disastrous for patients. A Pulitzer Prize-nominated investigation by Stat News uncovered that Medicare Advantage insurers are using AI to systematically cut off care for seniors. They're denying rehab stays, cutting short nursing home coverage, and flagging medically necessary equipment as inappropriate, all based on what an algorithm predicted, not what the patient's doctor recommended. One case involved a company called Navi Health, which uses an algorithm to predict exactly how many days a patient should need in rehab. In one woman's case, 16.6 days. Her insurance then cut off her coverage based on that prediction, even though she was still learning to put on her shoes with her arm in a sling. It took over a year and a federal judge to overturn that denial. And this isn't isolated. Between 2022 and 2023, claim denials surged by 55% in Medicare Advantage plans, and experts directly link that spike to the increased use of AI. A Senate investigation in 2024 found that the three largest Medicare Advantage insurers, United Health Group, Humana, and CVS Health, ramped up denials for rehabilitative care after adopting AI tools. The Senate committee report found that AI tools have been linked to denial rates 16 times higher than decisions made without the technology. So when Medicare says they're bringing AI into traditional Medicare, we already know how this story ends because we've seen it play out in Medicare Advantage. Traditional Medicare has historically been the gold standard when it comes to access to care. Unlike Medicare Advantage, you didn't need permission before getting treatment. You went to your doctor, you got the service, and Medicare paid the claim. Simple. Period. The WISeR model changes that for certain services. Starting January 1st of 2026, private technology companies will use AI and machine learning to review prior authorization requests for 17 specific types of services. Things like skin and tissue substitutes, electrical nerve stimulator implants, knee arthroscopy for knee osteoarthritis, epidural steroid injections, and several others. You can read more about this over on our website at naviquote.com. These companies will be paid a percentage of the money they save Medicare. You heard that right. They make more money the more services they deny. Now, Medicare says there are guardrails. They say all recommendations for non-payment will be reviewed by a licensed clinician using standardized, transparent procedures. But we've heard this before. A 2023 investigation found that doctors at Cigna spent an average of 1.2 seconds reviewing each case. That's not meaningful human review. That's rubber stamping whatever the algorithm said. And when you're dealing with services that could directly affect your health, a 1.2 second review is just not good enough. Here's something important. The companies that will be running this AI review are described by CMS as having experience managing prior authorization for other payers, including Medicare Advantage plans. So in other words, the same companies that have been denying claims in Medicare Advantage may now be making decisions about traditional Medicare. The application deadline for companies to participate was July 25th, 2025. But as of today, October 22nd, CMS has not publicly announced which companies have been selected. We won't know until the program launches on January 1st who's actually making these decisions. But based on what CMS has said, these are likely to be the same consultants and private tech companies that have been enabling Medicare Advantage plans to make money on prior authorizations to the disadvantage of patients. And the pushback is real. Over 40 members of Congress sent a letter to CMS urging them to halt the program, citing concerns about the use for for-profit companies and the lessons we've already learned from inappropriate use of prior authorization in Medicare Advantage plans. Former CMS Administrator Donald Berwick, who helped create some of Medicare's most important reforms, wrote an opinion piece saying that the WISeR model will not cut waste, but it will hurt seniors. What about waste and fraud? Now, Medicare will tell you this is all about reducing the estimated $5.8 billion in potentially unnecessary spending. And yes, fraud and waste are a real problem, but here's what they're not telling you. Medicare Advantage insurers overcharge taxpayers by more than $80 billion through upcoding and other billing practices. That's 14 times more waste than what prior authorization is supposed to address. Yet, there's no AI program targeting that. The waste in healthcare that CMS cites comes from a study showing that only 11% of overall waste, less than 3% of total healthcare spending, is from overuse. The rest is attributed to administrative complexity, coordination failures, errors in care, excessive pricing, and fraud. And prior authorization is guaranteed to increase administrative costs, not reduce them. So the question becomes, who is this really protecting? If you're in one of those 6 pilot states, and you're on traditional Medicare, here's what you need to know. First, the WISeR model does not apply to people with Medicare Advantage. It only affects original Medicare beneficiaries. Second, the model excludes inpatient-only services, emergency services, and services that would pose a substantial risk to patients if delayed. But for the 17 service categories that are included, you may face delays or denials. And keep detailed records. Save every denial letter, every piece of communication, and all medical documentation. Providers, to my knowledge, can resubmit prior authorization requests an unlimited number of times following a denial, and they may request a peer-to-peer clinical review. If you get denied, appeal it. Don't accept it. CMS has already indicated that if this model proves successful in reducing Medicare spending, they're considering expanding it to additional states and services and technology firms. So this isn't really just about 6 states. This is about the future of Medicare. We're less than 3 months away from this going live, and once it starts, it's going to be much harder to stop. I'm Callie Navrides, a licensed insurance broker and founder of NaviQuote. If you're in one of these 6 pilot states and you're concerned about how this might affect your coverage, or if you want to explore your options before January 1st, call me or schedule an appointment. My information is in the description below. We're licensed in Arizona, Texas, and many other states, and I can help you figure out the best plan for your unique situation. And if you've already experienced a denial that doesn't make sense, or if you have questions about any of this information, leave a comment below. I want to hear from you, and I'm sure others do too. And if this video helped you understand what's coming with AI and Medicare, please give it a like and subscribe to the channel so you don't miss future updates on these changes. And after that, click right here to check out my next video with more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.